Nurse residency programs. The 2010 Institute of Medicine Report, The Future of Nursing, Leading Change, Advancing Health, Recommendation Number 3 states, implement nurse residency programs. State boards of nursing, accrediting bodies, the federal government, and healthcare organizations should take action to support nurses' completion of a transition to practice program nurse residency after they have completed a pre-licensure or advanced practice degree program, or when they are transitioning into new clinical practice areas. On a busy day on a woman's care unit in an acute care facility, a new graduate nurse, Susie, walked up to the charge nurse and stated, "There's a visitor that's slumped over in the chair in room 12. I don't think she has a heart rate. Can you come and check her?" After rushing to room 12 and calling for additional help, the visitor was found lifeless with no pulse. CPR was performed by the experienced staff until the code team arrived and called the code. The visitor was lifeless, the patient in the room terrified, and the hospital staff and Susie were unsure about the new nurse's abilities. Susie did not call a code because she was unsure of her abilities. She had graduated nursing school, passed her licensure exam, but had never seen a real person without a pulse. She did not know what to do and was not prepared for the high demands of being a practicing nurse. Susie needed a nurse residency program to better prepare her for nurse competency and the leadership role expected of nurses. New nurses should always have questions. In the past, residency programs have been used in critical care, surgical units, and neonatal settings. However, all nurses need preparation to advance from the classroom to the clinical setting. Role transition, nursing turnover, competency, and patient safety can be addressed by a nurse residency program. Nurses are always active and engaged. The purpose of a nurse residency program is to provide support to the new nurse graduate in transitioning from a novice to a competent bedside nurse leader able to meet the demands of a challenging profession. High acuity and complexity of the acute care hospital make it impossible for even the best schools of nursing to completely prepare new graduates for the acute care environment. Schools of nursing provide a foundation that must be expanded once the graduate reaches the clinical setting. New nurses face many stressors while adjusting to the clinical setting. Inexperience and high stress levels make new nurses prone to error, which decreases patient safety and negatively affects patient health outcomes. The amount of turnover should be alarming to nurse leaders and healthcare organizations because the cost of training new staff is high. Turnover rates for new hires are between 13% to as much as 75% within the first 12 months. It is estimated to cost between $49,000 and $92,000 to replace a new graduate that leaves. The burden of new graduate turnover to a healthcare organization can be high. However, the cost of a nurse residency program can be a barrier to implementing the curriculum and decreasing turnover, thereby lowering costs to the organization. In the current healthcare system, it is important to economize and remain financially responsible by using programs that provide a positive return on the overall investment. The Institute of Medicine suggests that funding for diploma programs be reallocated to cover nurse residency programs, and that healthcare organizations, the Health Resources and Services Administration, Centers for Medicare and Medicaid Services, and charitable organizations should fund the cost of nurse residency programs. Residency program members should also sign a contract to work for the healthcare organization for at least 1 year after the end of their orientation, or be required to pay back the cost of the orientation. Although the initial cost of a nurse residency program may seem high, the benefits include increasing patient safety while decreasing nurse turnover, which in turn provides the healthcare organization with a positive return on their investment. In order to advance the health of the nation, new nurses should be fostered to become bedside leaders and should not be required to evolution to the acute care setting directly out of nursing school without a nurse residency program. Nurse residency programs advance the health of the nation by fostering nurses to become leaders, which will shape the future of healthcare.